is Rachel. I am an occupational therapy student. So I am currently in year 3 in Singapore Institute of Technology. I've worked with people with special needs quite a bit, and now I'm currently working with different types of people, those with disability, those who are elderly, mainly people who face difficulties in living their life to the fullest and need some help in that area. I think one thing that we can do is the Ministry of Health initiative. They have posters everywhere called FAST. Yeah, so it's actually 4 different things that you can look out for. The main prominent ones that I would say to really be aware of is when you are talking to a person, listen out to their speech, because the slurring of speech is actually something that is quite easy to actually identify. So when they speak to you and you start to hear the slur, that's when you also know, and really looking at their face, because usually for people who have had a stroke, so you start to see either like their shoulders or their face will start to droop a little bit more, and those are the physical signs that you tend to notice. Likewise, if it's on the left side, then the right side will start to droop. So it's really just identifying things like that. If you want to talk about identifying preventive things, would be seeing the stress of a person. So when you actually identify and notice that a person is really stressed out, or try to lower their stress a bit, because stress is actually one of the things that causes stroke. Yeah, high levels of stress. I think one of the major ones would be hypertension, because again, stroke is when there's a clot in your blood, and when you have high blood pressure, it actually increases the chance of you actually getting a stroke. So that is one of the medical causes. In Singapore, many people, because of the dynamics in Singapore, they actually tend to develop a stroke because of the high amount of stress they're receiving. They're aiming to be the top in their companies, they have family to look after, people to deadlines to meet, and all these added stress just really builds up in them. And with the lack of leisure activities or activities to actually help them relax a little bit more, it just causes the stress to keep increasing, and when that happens, that actually affects and can cause you to have a stroke as well. I think the major problem we're talking about after stroke, so once the person has a stroke, is really the recovery. So I'm not saying that it's totally difficult or impossible to recover, but it's very frustrating. So just think of it for yourself. So if you're a right-hander, use your hand. At first you'll be like, oh yeah, it's just my right hand, I don't really do much. But then when you have a stroke and after your right hand is impaired, you realize how important it is just to reach for something, just to comb your hair or brush your teeth or do something that is important to you. It's going to be really difficult, and that actually causes a lot of frustration. Things that are so simple, like just to reach, or like just to wipe a table, or just to scratch your shoulder, those are things that are going to be difficult for them to do. And because of that, there's a lot of built up frustration and anger, because these are things that you should be able to do, but you can't because of the stroke. And that actually goes on to the caregivers and the families as well, because it is hard for them because in their perspective, they're like, just do it, you can do it, just keep trying. And because you haven't felt that feeling of not being able to do it, it's really hard for them to feel for their family who has a stroke, and therefore it kind of adds on to the stress, as well as it can even cause like family restraints as well.